Hello, I am Hayden Hardy, and I will be presenting my independent research project, the comparison of dark and light honey, antioxidant and antimicrobial effects against oral bacteria Streptococcus mutans and Streptococcus salivarius. Honey is a natural sweetener that is commonly used for its medicinal properties, including its antimicrobial and antioxidant properties. These properties are due to the more than 181 compounds that are present in honey. They can be divided into two main groups. The major compounds, such as sugars, which make up 82.5% of most honeys, while water makes up 17.7% of most honeys. Other compounds consist of proteins, polyphenols, and vitamins. Honey is a complex medium with the exact composition of each honey depending on the floral source the honey was produced from, as well as the location and time of year the honey was collected. This means that different honeys have different compositions, and certain honeys can have superior antimicrobial and antioxidant activities. One of the more visible differences in honey is the color. The color of honey is assessed by visual measurement, and it can range from water white, which is basically clear, to dark amber, which is sometimes black in color. The color of honey is caused by the presence of polyphenols and pigments, such as flavonoids, with darker honeys seem to contain more pigments and polyphenols than lighter honeys. As darker honey should contain a higher amount of polyphenols, buckwheat honey, the dark honey used in this experiment, should contain a higher concentration of polyphenols than acacia honey, the lighter honey used in this experiment, resulting in a higher antioxidant and antimicrobial activity against bacteria S. mutans and S. salivarius. To test this, samples of both buckwheat honey and acacia honey were taken and subjected to an extraction including base hydrolysis, liquid-liquid extraction, and solid-phase extraction. The extracted samples were then used in a Folin-Chocolat assay to determine the total polyphenols in each extract, using a gallic acid standard to determine the gallic acid equivalent units. The samples were then used in a DPPH assay to determine the total antioxidant activity in gallic acid equivalent units as well, using a gallic acid standard. After extraction, the antimicrobial activity of each honey was tested in a broth dilution assay to determine the minimum inhibitory concentrations of the honey, as well as a disk diffusion assay to determine the zones of inhibition caused by the honey against growing S. mutans and S. salivarius bacteria. The polyphenol extraction initially began with base hydrolysis due to some of the polyphenols present in honey being bound to glucose molecules. Following this, liquid-liquid extraction was performed with ethyl acetate to remove the polyphenols from the honey sample. Finally, it was important to use solid-phase extraction to remove the sugars from the extract, as they were seen to cross-react with both the Folin-Chocolat and DPPH assay due to their phenol shape. Seen here in Figure 1, buckwheat honey, the darker honey used, had a significantly higher amount of polyphenols with a concentration of 24.2 microgram per mil, compared to acacia honey, which had a concentration of 6.8 microgram per mil. As expected, most likely due to the higher concentrations of polyphenols, the total antioxidant activity seen here in Figure 2 shows that buckwheat honey had a significantly higher antioxidant activity with a concentration of 15.87 microgram per mil, while the acacia honey only had an activity of 2.4 microgram per mil. Antimicrobial activity determined by the broth dilution assay can be seen here in Table 1. After 24 hours of bacterial growth in the honey, acacia honey can be seen not having any inhibition against either S. mutans or S. salivarius, while buckwheat honey had a minimum inhibition of 25% against S. salivarius and 50% diluted against S. mutans. These results are similar to the disk diffusion assay seen here in Table 2, where acacia honey exhibited no inhibition of the growth of either bacteria on the plate, while buckwheat was able to inhibit the growth of S. salivarius with a zone of inhibition of about 6 millimeters, although it didn't inhibit the growth of S. mutans, which could have been due to S. mutans being observed to grow faster than S. salivarius during the study. Overall, buckwheat honey had a higher total antioxidant activity as well as antimicrobial activity against S. mutans and S. salivarius, most likely due to the significantly higher polyphenol concentrations compared to the acacia honey. As the main factor responsible, the high sugar and low water content was removed during extractions or dilutions. These results show that darker honey such as buckwheat honey should be used when using honey for its medicinal properties, whether it be for personal use or in the medical industry for products such as medical grade honeys.